Hello, my name is Dr. Lance Bezzina. I'm a cardiothoracic surgeon at Bryan Heart. I was fortunate that I've always known I wanted to be a doctor. I didn't know exactly which field I wanted to go to until I was in general surgery in the residency program there. I had a mentor that kind of guided me into cardiothoracic surgery. I was born and raised in Detroit, Michigan, and that's where I went to college. I went to the University of Michigan, and then I went to med school in Kentucky, and then I came back to Michigan State actually for general surgery. Then I went to Baylor, Texas Heart, where I learned cardiothoracic surgery through that fellowship. My wife and I are both from the Midwest, so we always knew we were going to come back to the Midwest. Everybody that's here wants to be here, wants to work, wants to have successful patient interactions. Cardiothoracic surgery deals with all surgery in the chest, essentially from the top of the abdomen or the diaphragm all the way to the neck. So we deal mostly with hearts, valves, and bypasses, but we also do lung surgery for lung cancer and other lung diseases. For the patients, they're going to experience similar symptoms, chest pain, shortness of breath, things like that. So it's important for the patients, if they're experiencing those symptoms, to not overlook them. In relation to lung surgery, it's actually similar, shortness of breath, but a lot of times we find lung cancers incidentally. The earlier we catch it, the more options you have, including surgery to treat it. In addition to treating people as if they were my family member or how I would want to be treated when I'm the patient, I would say that the other guiding principle that one of my mentors taught me was that at the end of the patient-physician interaction, both of us should feel better. No matter what news we have to break, we have to get a plan together, and hopefully at the end of the interaction, both of us feel better than at the beginning. I would say the biggest advancement in the last few years previous to this is minimally invasive valves, meaning transcatheter aortic valves. We call them TAVRs. Here at Bryan, there's also programs of doing that in the mitral position, which is quite cutting edge. Patients are going to get these procedures done. They're going to be in and out quicker, recovery times faster. That's where we're going to see a lot of growth and development. I'm very lucky in the sense that the job I have is the job that I think I was meant to have and love. Well, I get the glory, I would say, of helping the patient, that I have a team of probably 24 people behind me that allow me to do what I do, and they're just as important as me. When they do good, it makes me feel good, and makes me feel that the time that we put in as a team was worthwhile.